um, once again thank everyone who has been attending these talks. That we appreciate your interest in dealing with your mental health. So I think there are two things I wanted to talk about tonight before we start getting into some questions. One is this idea that there are degrees to mental illness. Okay, so let's talk a little bit about that, because that seems to be what I'm getting a lot of questions about. So what do I mean by that? What do I mean that there are degrees of mental illness? There are degrees of things that we struggle with. Well, the main thing that I mean about that is that we are conditioned to believe that mental illness is kind of an all or nothing thing, that we're either mentally ill or we are completely mentally insane, or we're completely mentally healthy. So one of the things I'm encouraging people to look at is to really own what degree of mental illness they have. Now, why is that important? Because the only way to really work on our mental health is by acknowledging that we have something to work on. So part of what I encourage people to look at is, what's a reoccurring pattern in your life that you see over and over in relationships? Is it, you feeling as though you're not getting everything you need out of something, or you feeling like you're not being heard, or whatever it may be? The issue that I'm seeing more and more with people is that they don't want to admit that they have issues. They don't want to admit that they have something going on in their life that is affecting them. This is the thing that, again, I see over and over and over with people, is we've been kind of led to believe that there's something wrong with what is going on with us. So we hide it, we constrict it, and then it doesn't get any better. So I'm seeing that there may be a little bit of a technical issue, because I'm not, once again, getting, So I think what we need to look at, again, I'll just work through it. I think what we need to look at is, what is the degree of mental illness that you have? Now, why is that important? Because the only way you're going to ever really work on anything that you're struggling with is if you're willing to admit that there is something up with you. So I'm going to follow up with some questions that I had from a previous guest. Angie is struggling with some pretty significant issues, and she texted me some things that's going on with her. And what she's finding is that there's a conflict between her her ability to be mentally engaged with her church, spiritually engaged, and deal with her mental illness. So what she has is sort of this conflict where her church is telling her, no, you can't have this and you can't have that. You can't be part of our church, but you also can't get help from your mental health practitioner. Now, why they're setting it up that way, I really don't know. I don't know if this is going out because the third-party software I'm showing isn't showing any texting or So if you have a question, please submit it either through YouTube or straight through on Twitter or on Facebook. So what I would encourage Angie to do is to really make a decision about what she needs for herself versus what the guy, what she's getting from somebody else. The reason that's important at this point is because she's feeling, what I'm guessing is she's feeling that there's a conflict with being told that she should only talk to, people in her church versus getting help from other people. She talked also about having some issues with anxiety, going out in public and having situations where people are either judging her or she's being made to feel nervous. That could be a whole gang of things, meaning that could be something stemming from your past. That could be something stemming from you guys have heard this over and over, your relationship with yourself. So what I would encourage Angie to look at is what is going on when she leaves the house. What is she telling herself about her situation that is causing her to feel that she is, I don't know, feeling crazy or feeling like, and by the way, when I say crazy, we all struggle with that, guys. That's nothing specific to anybody. So what I would encourage Angie to look at is, I get anxious and sick and just thinking about going out. Long story made short, there's some issues that she's dealing with different aspects of her life. She asked me not to, disclose too much about it. But when people have these issues coming on them, they generally don't have a way of dealing with them because they're not in a situation where they're comfortable talking to people about them. So if you've seen any, thanks Diego, I'll get to your question in a second. If you've heard anything from me, you'll hear it over and over and over. Dealing with your mental illness, dealing with whatever is on your mind, you've got to deal with it. You've got to talk it through. The second part of what I wanted to get to was, people aren't really aware of who they are. They don't really know what they're thinking. They don't know what they're feeling. A lot of people don't really have a what's called mindfulness, an awareness of their thoughts. And that there could be many reasons for that. One of the main reasons for that is that people don't like what's in their mind. If your mind was just producing a whole bunch of happy, content, joyful thoughts, people probably wouldn't have an issue with that. But because we're not comfortable with what is in our mind, we don't pay attention to it. We don't like to feel it. We don't like to think about it. We don't like to acknowledge that we're feeling whatever we're feeling, because that would then set us up for feelings like, what is going on with me? So, but that is the issue. That is exactly what we need to be working on, because if we're not working on it, if we're not dealing with what's in our mind, it's going to just continue getting the best of us. So I'll come back to this and I'll finish up with Angie. Angie, there's a lot going on with you that it's hard for me to address it because you said you didn't want me to talk too much about what's going on openly about this, but religion and churches don't believe in mental illness. Now, I don't even know what that means. What does that mean? A church doesn't believe in mental illness. Well, that could be a lot of things. You can sense tonight, I'm hesitating talking too much about this because Angie asked me not to get into all the details about this. But what I would then ask is, what is preventing? Why would a church prevent somebody from healing if they need to heal? Is it that only God will heal you? Okay, well, maybe God helps those who help themselves. So, but Angie, what I would recommend is you've got to sort of come to terms with this conflict you have between your church, your religion, and whatever degree of mental illness that you're struggling with. Okay. So I know that probably doesn't help, only because there's a lot going on that isn't going to be cured in one conversation online. But the fact that you're texting me and sending me a lot of these questions means obviously that something inside of you is trying to heal. So I would recommend that, you pay some attention to that, and the question you asked is, I have a very hard time going out in public or even out for a walk during the day. I get panicky and frantic. That is an underlying anxiety disorder that needs treatment. You've got to get into the ABCs of thinking. Remember, activating event, belief, consequence. What is going on within you that is causing you to be scared and frantic? We have a lot of irrational beliefs, all of us do, about things in our lives or things in our in the environment around us that cause us to then feel scared. I mean, coronavirus alone, am I going to catch it? Am I going to give it to somebody? So what I would recommend is you got to deal with the shame. You got to deal with what's going on, because the fact that you're ashamed of feeling the way you do is only going to make the situation continue to get worse, because you're going to be in a situation where you don't want to deal with it. You don't want to admit that you're dealing with it. And that's the thing with like I said, there's degrees of mental illness. People think mental illness is an all or nothing thing. It's not. It's not. There are degrees of physical illness. There are degrees of mental illness. People need to start working on it. So thanks, Angie. Feel free to send me some more questions, and we'll see what we can do. Diego. Doctor, what can be some basic or entry-level tactics to change habits which can lead to change behavior? Excellent, Diego. What I would recommend, you have to isolate exactly what you want to change. So let's take, for instance, if, I don't know, it's some sort of addiction. You've got to look at, what is my goal? People may think that there's a black or white again when it comes to working with addiction. I've worked with people at multiple levels of addiction. Some people want to go completely sober. Some people just want to bring it down from the craziness of passing out and blacking out. And who am I to judge? That's why I don't impose a system. I had a gentleman that took, like I said in my last video, a lot of exception to, I guess he was from the AA model, and AA model believes in abstinence and total abstinence, and that's their model. So great, good for them. But unfortunately, that doesn't work for everybody. Some people want different levels of treatment based on what they're struggling with. So some basic or entry-level tactics to change habits. You got to identify what your goal is, Diego. I mean, what's your goal? Maybe you want to follow up here. What's your goal? Is your goal to completely stop something, or is it to bring it down to a manageable level? Then you need to identify, hey, Kimberly, then you need to identify, what is it that I'm trying to change? Why am I trying to change it? What is going on with me that something needs to be changed? So what I would recommend for you, Diego, is you got to look into your beliefs. Okay. So your beliefs, like we talked about in a previous video, you've got, hey, Mazzano, thank you for joining. Please ask a question. Please share this, guys. We got to pull some more people in. The thing about changing behavior is you got to look at changing behavior like you would look at, I don't know, building a house. You got to start with a blueprint. You got to figure out, okay, this is what I want to do. Next step is, what are my goals? Why? For better health with my family. Okay, bring it down. Okay, excellent. Why? Why? For better health with my family. So it sounds like there may be a substance abuse issue or an anger issue that Diego needs to work on. So if that's your goal, for better health with my family, that leads me to believe that what's going on with your family now isn't too healthy, bro. So you got to pull them in a little bit, get some feedback from them. Like if you're feeling your behavior is affecting your family, talk to your family. Go up to them and say, hey, how am I affecting you? Which is another thing we don't do. We don't take responsibility for how we affect people. I posted some things a few months ago about the difference between real mental health and social media mental health. The idea, because social media mental health will tell you, oh, let it go, get rid of it, don't think about it, don't let it affect you. Reality mental health is, you've got to own that we all have the capacity to affect other people. That's just a reality. There's nothing wrong with that. We need to own that. So if Diego wants to change behavior that's affecting his family, I would encourage him to talk to his family. Thanks, Sean. I'm going to get to your question in a minute. Good one about narcissism. That's the hot topic. Everyone thinks everyone's a narcissist these days. So, but lay it out, Diego. What do you want to change? What do you want to bring down? Maybe your family, let's say, I don't know, maybe you're drinking too much. Maybe you want to bring it down, but they want a Diego free of alcohol. You guys got to talk that out. And then you got to look at the belief system that's holding in place Diego's behavior, because everything starts with cognition, meaning how I think. That's why it's called cognitive. Okay, he just said alcohol and my life is good with my wife and kids. This is from my upbringing closure. Okay, great. So that's what I thought. Diego's struggling with some alcohol issues, bro. And great that you're open and talking about it, Diego. That's the first step. You got to own, okay, maybe I did learn from my dad or my mom or whoever taught you that drinking, and I know the feeling. I was raised with a functioning alcoholic, so every night it was drinking, and that got passed down to people in my family. So Diego, you got to look at the beliefs. Like, what did you learn? Maybe it's a cultural thing. In Hispanic culture, people drink a lot. Maybe that's just the way it is. But you've got to look at what is affecting your behavior, meaning what are the belief system that's affecting your behavior? A lot of men believe, hey man, I am who I am. I got no apologies to make. This is who I am. Take me or leave me. And that has a really disastrous effect on people around you. So Diego, here's Diego's question. What are some entry-level tactics to change habits, which can which can lead to change behavior? The first step, my brother, is working on the belief system that's holding it in place. What is the belief system that is holding it in place? What is going on with you that is causing you to feel the way you feel? That is the main thing that you need to look at. What is going on with you that is causing that to perpetuate in you from yourself, meaning your belief systems? Remember, cognitive behavioral psychology, people, my cognitions affect my behavior. So what I think and feel affects how I behave. So what I'm hearing from Diego is that there's some things going down. He says he wants to just bring it down. You should check with your family as to what they would like too. All right. And again, brother, feel free to shoot me some other questions or whatever, if I can help with anything. But you took the first step today, is identifying that there's a problem. Men. I was talking to my neighbors today, and we were talking about things. And I said, quite honestly, I wish we could just turn the world over to women for a little while and see how they do, because men, a lot of times how we are raised affects the world around us. And most of us, myself included, are not being raised by enlightened fathers who are giving us permission to feel. We're not seeing, oh wow, look at daddy apologizing, or look at daddy working on himself, or look at daddy saying that it's not me, it's him. We don't see that growing up. So men, keep all that negative emotion inside, and it comes out with needing alcohol. So, great, man. He's saying, well, I can let you read his thanks. Makes so much sense. And yes, and I'll keep you posted. Great. Definitely keep me posted, man. And don't hesitate to send me messages, because you're at a stage now, which is called a contemplative stage, which means you're contemplating. Can I do this? I mean, should I do this? Is this something I want to do? Yes, my brother, it is something to do. Alcohol is one of the biggest lies sold to us in our culture. Alcohol companies could care less about the damage they do, and it's all about money and ingesting a substance that causes chaos. If there was anything else that people were ingesting and causing public health the way alcohol is, it'd be off the market. But no, money rules. Anyway, Diego, thanks for your question. I appreciate it. Jamela is saying, why am I afraid of being alone? Great question, Jamela. I would ask you, what does being alone mean to you? What does being alone? Does being alone mean that you are a loser? Does being alone mean that you are, nobody loves you? What is it about being alone that causes you to feel, like you're a loser or something? Why am I afraid of being alone? Jamela, again, I don't know you. Sounds like something from your past. Sounds like you were left alone a lot as a kid, or you were abandoned, or somehow when you were younger, being alone was a negative thing. So maybe, I don't know if you're an only child or you went through a bad divorce when you were younger, but if you're afraid of being alone, getting back to what I was working with Diego on, you have a belief system about being alone. So you have a belief system that tells you being alone means XYZ. So when being alone is a negative thing, you're afraid of it. Now, look at what fear is. I didn't come up with this acronym, but fear, FEAR, false evidence appearing real. Okay? Fear, FEAR, false evidence appearing real. Great acronym, because that's a lot of what fear is. We get afraid of something because in the present, we are telling ourselves that this is going to happen in the future. This is what is going to happen in the future. So maybe with Jamila, she is saying that when she's alone, like she's already in the present telling herself, sorry, I'm getting worked up, but in the present, she's telling herself, when I'm alone, I'm going to be down. This is killing me. I hate being alone. There's something about being alone that has a negative meaning for you. And until you work through that, you're not going to be able to figure out exactly what is going on. So one of the things I would encourage you to do, Jamila, is ask yourself, why am I afraid of being alone? Ask yourself that question. This is what I was going back to about one of the topics I wanted to discuss tonight was self-awareness. Why am I the way I am? This is not something we are comfortable asking ourselves because it leads to, people feeling insecure. It leads to you like, well, why am I? Well, who am I? And then who am I? Then what? And those are existential questions that we need to ask ourselves. So Jamila, get into that. Ask yourself that. Like, let's say, Jamila, you were raised as a racist, but you didn't want to be a racist anymore. So you would start asking yourself questions like, why am I a racist? Why am I hating this white guy? Why am I hating this black dude? You would ask yourself these questions. And the more you ask yourself that question, the more you're able to get into exactly why you are the way you are. And this is what we need to ask ourselves more. Why are we the way we are? Okay? So I hope that helps. Again, you remember the it's okay pill. What's the it's okay pill? It's okay that I'm afraid of being alone. It's okay. It's okay that's what Jamila needs to work on with Jamila. It's okay that I'm afraid of being alone. I'm not going to hate myself because I'm afraid of being alone. If I hate myself for being alone, then odds are I'm going to continue hating myself, and that's only going to perpetuate the problem, which is going to make me more alone. So maybe it's a self-esteem issue too, Jamila. Maybe you've been hurt a lot. Maybe you feel, who's going to want to love me? Wow, what would maybe Jamila doesn't like herself a lot. But the fear of being alone is usually tied to abandonment issues. Now, I don't know if you're still on or you're not, you don't want to give me any more background, but that's fine. But what I would recommend is that you get into where you learn to be afraid of being alone. And I will almost guarantee you that it comes from, I was just about to say it, and here we go. When I was younger, I was being raised by an abusive cousin, me and my two other siblings. My mother was alive, but I let it happen. My mother let it happen. Thank you, Jamila. Thank you for sharing that. Guys, please, if I was a pediatrician or a dentist or whatever, you would be sending questions and talking openly about it. I'm a psychologist. This is great. Nothing wrong with talking about this. There's a thing when one of the reasons I'm doing this is called normalization. So normalization is the idea that you try to normalize for clients and patients. You're not alone. You're not alone. So exactly, Jamila, exactly what I was thinking about. When I was younger, I was being raised by an abusive cousin, me and you and your two other siblings, and my mother was alive, but she let it happen. So odds are, I'm guessing your relationship with your mom ain't that good, because she left you alone with this abusive cousin. And if the abusive cousin was sexually abusing you or your other siblings and you haven't worked on that, sister, that is an emotional wound that is sitting in you that needs to be addressed. And just to get into that real quick, people have this idea that, this kind of work is, oh my God, and I don't want to deal with it and blah, blah, blah. And in the beginning stages, that's how it is. It is painful in the beginning. But the more you expose yourself to it, remember, exposure therapy is part of it. The more you expose yourself to what you're afraid of, the less the fear comes down, because you start saying to yourself, oh yeah, that was painful, but it wasn't that bad. It actually felt good to talk about it. So Jamila, you got to work on some of that pain, and maybe you have and maybe you haven't. But if you're still afraid to be alone, you got to sit with that. Jamila has to say to herself, it's okay that I'm afraid to be alone. It's okay. I'm not going to be ashamed of it. I'm not going to be ashamed of being alone. By the way, thank you for everyone sending questions. Please, if you're out there, please send a question, please. Okay. Please. We need to talk openly about our mental health. I could fill hundreds of hours of talks about different subjects. That is good. That'll get me viewers. That'll get me this, but it's not going to be as effective as engaging with everybody on what's going on. So thank you for your question, Jamila. I hope that helped. First step is say to yourself, it's okay that I'm afraid to be alone. It's okay. I don't know if you're, 16, 26, 46, 66, whatever. It doesn't matter at whatever age you are, whatever you're experiencing pain-wise, emotionally, make it okay. Once you make it okay, then you can work on it. One of the reasons most people don't work on things is because they don't make it okay. And I don't know if you guys can hear all of this in my voice, but the reason these concepts may seem new to you, but I seem very familiar with them, is because I've been doing this for years. I've been talking to thousands of people back and forth about these issues, tens of thousands at this point. So thank you for your questions. Keep them coming. I hope that helped. So let me move down here. So Shauna is saying, hi, how can I communicate with my toxic narcissistic sister? Well, loaded question, but great one. Okay. So narcissism. Let's talk a little bit about, there's tons of people out there talking about narcissism. Most, if not all of them, have been affected by a narcissist. So that's their way of healing. Again, remember, if you're going to take advice from somebody, if somebody's going to tell you how to get well, you should try to find somebody in the field, licensed with training and working with these types of issues, because it's going to help accelerate the healing. Okay. So back to the question. The issue with narcissism is this. Okay. Narcissism is the idea that there's a constellation of behaviors that is affecting another person that another person has. So the typical idea of narcissism is that the narcissist has no empathy, does what they want. It's all about them. They manipulate people. They take from people and don't give a lot. And there's a whole bunch of things, but lack of empathy is the key thing. So what I hear being said here by Shauna is, how can I communicate with my toxic narcissistic sister? So Shauna, we got to work on how we are relating to your sister in your mind. Okay? Sounds like, rightfully so maybe, there's a lot of anger there. There's some resentment. There's something going on where I don't know what is going on from her side of the story. But I would try to, one of the things that helps disengage people is, I don't know if you guys have heard of judo, the martial art judo. So basically the idea behind judo is the gentle way of mastering an opposing force by giving into it. So you master the opposing force by giving into it. So what I encourage a lot of people to do when they're in conflicted relationships is go first with owning your part of the degradation of the relationship. So I would recommend, if you're serious about wanting to communicate with her, ask her, honey, what have I done? Like, why are you so angry? Why is our relationship so toxic? Let me hear. Let's start with me. How have I affected you? What that does is, and the people might be out there saying, well, you're going to give that person fuel. You're going to give that person fire to use against you. Maybe. Doesn't mean you need to own it. But maybe there's some information in there that you missed that you were causing in that person. So what I would recommend is you try to come at your sister gently. Where and if you're still on, Shauna, does she have that narcissistic vibe to her? Like, is she, like, if you're still on, just shoot me a response to that, meaning, and I'm sorry, not narcissistic, lack of empathy. You said narcissistic, but lack of empathy. Does she have sort of, that feeling of she's got no empathy? She's got no, doesn't care about anybody else but herself. so Shauna's saying I was in an abusive relationship, marriage, and she blamed me for staying. That ain't going to help. And people, I talked about this in a previous video. Blaming somebody for staying in an abusive relationship is abusing the person who's in the relationship. People think that that's, you're motivating them, or you're letting the abuse happen. I'll say it again. I said it years ago, and I took some flack for it because Steve Harvey had posted something, and I got into it with him and some other people on his site because he was like, "Oh no, you're letting yourself get abused and all that." No, the abuser is letting himself be an abuser. That's what it stands for. So, I mean, not what it stands for, but that's the bottom line. The abuse victim is not letting the abuse happen. People stay in abusive relationships for a myriad of reasons. Some of them people wouldn't even understand: fear, insecurity, financial dependence, low self-esteem, all of this. Telling somebody, look at Shauna. This is exactly what I'm talking about. Her sister was telling her while Shauna was in an abusive marriage, that blaming her for staying, as opposed to, honey, what's going on? Why are you staying? Tell me, why do you feel trapped? Why do you feel you can't leave? So obviously Shauna, with her sister coming at her like that, they're not very close. So they're really, I don't know, Shauna, have you ever told your sister how it affected you when she blamed you for staying in the relationship and the lack of empathy? So yeah, that would be a good example that maybe your sister doesn't have a lot of empathy. But Shauna, what I'm hearing from you is if you stayed in an abusive marriage, there's some wounds there that maybe need healing, that need talking out. And again, yeah, a plumber is going to believe that, certain techniques to help your pipes get clear is going to work. I'm a different kind of plumber. Talking things out is the number one way of healing emotional wounds. Listening and reading and having people empathize with you, all good starts, but you gotta talk the pain out. So Sean is now saying, my sister has been abusing me verbally since I was 12, telling me that I was prettier, that she was prettier than me, going back to my other assumption from your first text, that there's some issues there with you guys that go way back. So yeah, that's not going to help your relationship. Clearly there was some sibling rivalry. I don't know how much older she is or younger, but these are issues that need to be addressed. So to wrap up, Shauna, thank you for your question, by the way, but you got to figure out a way to come at her so that the two of you can start flushing some of these issues out. Find a counselor. There are master's level counselors, there's doctoral level counselors. Find somebody to mediate it. Tell the counselor, this is what I want to work on. I want to get my sister and I. Clearly, you still love your sister, or feeling some emotional pull to work things out. Go with that. Figure out a way to talk to each other in a way. And you know what, Shauna, if you've figured it out, if you've tried and it doesn't work, maybe doing some work at accepting that you're not going to be that close. So Shauna is saying, I clam up when I try to talk to her. We are 2 years apart. I'm assuming she's older. So, Shauna, I would ask you, why do you clam up? Why do you feel inferior to your sister? Sounds like there's some classic, I mean, it's not really a mental health diagnosis, but that whole idea of an inferiority complex. Why is it that you feel inferior to your sister? What is going on there? If you guys are watching this on YouTube or Twitter, please ask a question, okay? You got to talk about, I almost said the SH word, but I won't, the crap on your mind. You got to talk about it. So Shauna, I would recommend you asking yourself, why do I clam up when I talk to her? Like, why do I get so scared? What is going on? Why does she intimidate me so much? That would be something. She gaslights you. Okay, so she makes you feel like you're the crazy one. Well, Shauna, we're all a little crazy. Maybe own that and then see if that draws her out. But the key is you're going to at some point have to say to your sister, look, if we can't work on this, If you continue gaslighting, making me feel, we're not going to have much of a relationship. And I know that's difficult for people to hear, but a lot of times you got to draw boundaries with people in your family who consistently hurt you or consistently make you feel less than yourself or whatever. So Shauna, you also got to work on Shauna's relationship with Shauna. It sounds like Shauna doesn't really like Shauna that much. Shauna focuses maybe on what's bad about her. You know, when you're in an abusive relationship with an abusive partner, that partner will erode your self-confidence and your self-esteem. So it sounds like you got to do some work on that. Remember, the It's Okay pill, okay? theitsokaypill.com if you want to reach my website. But you've got to own that you've got these issues and it's okay, but you got to work on them, okay? There's nothing wrong with having issues, people. I have issues. People in my immediate sphere has issues. Who do you know that doesn't have issues? The difference is we need to talk about them, okay? So I hope that helps. You're on the right road. You're starting to talk about it. Please tune in on Wednesday and let me know if you've made any inroads. If not, we can figure out maybe, I don't know, exchanging some private messages or whatever I can do to help. Let me know. Okay, Shauna, thank you for sharing. I appreciate that. Let's take a look. I believe another question came in. Let's see here. Dennis Suggs. Thank you, Dennis, for your question. Good topic. Thank you. The last 3 years, I've developed a gambling problem, and I really believe it is because of my relationship. I think Dennis and I spoke at some point that I am in and the things I've been going through, but definitely want to stop because this is not me. Great, Dennis. So I hope you're still on. So let's do some real quick treatment on you for not that this is going to cure you. You're not going to be cured, but I'm just going to give you an idea of what the beginning stages of great, Shauna. Well, thank you. I appreciate that. I'm glad you feel refreshed. That's what I'm talking about, people. Holding this shit in is not, holding this stuff in is not going to help you heal. You get it out of you even by typing. So thank you, Shauna. I'm glad you feel a little bit of relief there. So Dennis is talking about a gambling addiction he has, and this is not him. So Dennis, my brother, what I would encourage you to look at is, what's the payoff from gambling? What are you getting from gambling that is causing you to keep going back? Now somebody would say, well, dude, that's obvious. It's not obvious. People get multiple payoffs from whatever addiction they have. Step number one, Dennis, is, again, like I said to Shauna before and Diego before that, you got to make the fact that you have an addiction to gambling okay. Now, what do I mean by that? I asked this question in a previous video. I'll ask it again. I've been doing this for over 20 years, worked with people with addiction in multiple settings. Let me ask you guys something, and feel free to answer, because once I ask, it'll seem obvious. How many self-loving addicts do you think I've worked with? How many self-loving addicts do you think I've worked with? Okay? So obviously, hating your addiction and hating yourself fuels the addiction, because the addiction is something that makes you feel good, whether that's winning, whether that's, the moments before you win. Maybe it's that communal feeling of gambling. Maybe it's that feeling that, God, if I just get this scratch off. So Dennis, if you're still on, what kind of gambling? Tell me what kind of gambling you're doing. But the fact that you are owning that you have a gambling issue, brother, is the first step. And you're right. When you say, I definitely want to stop because this is not me, you're damn right it's not you, brother. Somewhere along the way, you learned that you needed gambling as a way of either detaching you from what's going on in your life. And like you said, a lot of it may have to do with your relationship and the negativity associated with that. But you're right. It's not you. The gambling is not you. But you got to own that it is part of you. You got to own that, man, because once you own that, then you can work on it. Once you own it, you can work on it. Horses. Okay, so great. That is obviously a very social environment. There's a certain prestige associated with that. So you get a feeling of going someplace. That's another thing an addiction does. It gives you something to do. It gives you something to do. Thanks, Amy. Great question. Hold on, Amy. I'll get to that. It gives you something to do. So what I would recommend for Dennis is, bro, you've got to, and by the way, I call everyone brother and sister. It's just a thing. Some people look at it like I'm being what is that word? Phony or fake, but it really is just the way I communicate with people. So you're doing the first step, Dennis. You're saying, this is not me. Now, this is the way you got to start talking to yourself, Dennis. You got to activate that self-talk. You got to say to yourself, you know what? Screw this. This is not me. I don't need horses and gambling to feel good about myself. You got to start relating to yourself that way, because if you don't, you're going to start hearing yourself saying, yeah, come on, why not? Just a few, maybe I'll hit it big. I'll get the trifecta or whatever, or I've got the system figured out. That is going to perpetuate it, Dennis. Okay. You're going to perpetuate it by what you're telling yourself. You've got to start saying to yourself little things. It's not going to be quick. You got to start saying, I don't need horses. I don't need to gamble. I don't need this. One of the things about addiction is the way the person relates to their addiction perpetuates the addiction. And one of the things I've found in working in multiple clinical settings is self-hate perpetuates the addiction. Okay. People who are addicted to something hate that they're addicted to it. So they spend a lot of time hating that they're like this. But Dennis, I'm telling you, brother, you're further along, because not only are you contemplating it, it sounds like you're trying to contemplating making a change, but it sounds like you're actually trying to put together a plan. I don't know how you feel about group meetings. Maybe there's an AA or a Gamblers Anonymous group you can go and talk to and just commune with people who are doing the same kind of behavior. I would look at, Dennis, like where did you learn that this type of behavior is acceptable? Did you see your dad? Did you see your dad working on it? I'm going to get you in a sec, Amy. Thank you. Did you see your dad betting on horses? How is it? Why is it specific to horses? Is there something about animals that you were around as a kid, or I don't know? But you got to look at some of the so it's called psychodynamics of where you learn that this type of behavior is acceptable. Okay. So that's the main thing I would encourage you to do, Dennis, is keep going, brother. Don't give up. This is the beginning. You saying to yourself, looking in the mirror and go, this isn't me. This isn't me. And I go back to the idea of racism. They're no born racist. My 4-year-old kid isn't a racist. Now, if I go to him every night and tell him, you're going to hate all white people or you're going to hate all black people, he'll identify with that. The key is waking up and saying to ourselves, this isn't me. And yes, do I believe a motivated racist can make some changes? Absolutely. Dennis, you can do that with yourself, brother. You can say to yourself now, tonight, tomorrow, this isn't me. I got to start cooling this out. Start slowly. If you go to the track 2 times a week, 3 times a week, break it down. I'm only going once next week. If it's once a week, I'm only going twice this month. And then manage that anxiety that the track and there are protocols that you're going to need to learn, because one of them is how to handle withdrawal. People hate withdrawal. People hate, I've worked in substance abuse facilities where people come in and they're shaking and they're like, no, man, I can't deal with this. The withdrawal is like that initial thing that people don't go through to get to the other side, because the withdrawal is so people, I can't handle it. Dennis, expose yourself to some of the withdrawal slowly expose yourself to what it feels like to not be able to go gamble, and then deal with the belief system that is coming into your mind. All right, brother, I hope that helped. Please follow up. I'll be on Wednesday and Friday. If you're watching this after the fact, Monday, Wednesday, Friday, 9 p.m. Mountain Time. Please engage. If you're looking at this on Twitter or YouTube after the fact, send me a question. Try it out. Start working on your issues. There's nothing wrong with that. Okay. So, thanks, Dennis. Let me know how things are going. Tina, thank you. I'll get to your question in a second. Here's Amy's question. Great question. What is your opinion of positive thinking, changing your mindset? Well, I'm all for positive thinking, but you know what else I'm for, Amy? Negative thinking. Neutral thinking. It's not all about being positive, people. You can't just deny that you feel negative. You can't. This is what is crippling most of not crippling, I'm being a little dramatic, but what is affecting people is this idea that they have to. Tina, thank you for your question. I'll be with you in a sec. We're getting short on time here, but I'll do what I can. I am all for positive thinking. I'm a great believer in positive thinking. But you know what I'm also a great believer in? Like I said before, negative and neutral thinking. People don't, the reason you see these YouTubers, and they got a lot more views than I do, I'll give them that, because they're selling it, man. Oh, you can be free of negative thinking. Tony Robbins is great for this. We're dying within. And granted, the dude has way more money and followers than me. But one of the reasons he's never allowed people to study his efficacy is because once you get that pump up effect, and then you don't know what to do with the negativity. And this is what is causing people to feel like they're never going to change, because they believe, great, Dennis, working on it, brother. That is exactly what I'm talking about. You're not going to heal it right away. You've got to get into the mindset of, I'm working on it and it's okay. There's nothing wrong with this. Somewhere along the way, I learned to need horses and need gambling. I got to look into that. Great, Dennis. Let me know how it goes, please. So back to Amy's question about what is your opinion of positive thinking? I'm all for it. I love positive thinking. I love optimism. I love being hopeful. I'm all for that. But you know what I'm also okay with? Sometimes I feel down. Sometimes I feel negative. Sometimes I just feel neutral. And that's okay. You got to learn to deal with your negativity. Because if your whole goal, Amy, is to just be positive, that is not a very realistic model, sister. I'm sorry. I mean, I'm sorry to tell you that trying to just be positive is a 1/3 of the picture. You gotta deal with the negativity. There's nothing wrong with feeling negative. Nothing. In fact, a lot of growth can come out of the negativity. But why don't you hear a lot of the self-helpers and the YouTubers talking about, and they have all these, just let it go and just roll it up in a piece of paper and toss it out. And why do they do that? They don't know how to deal with negative emotions. They're not trained in dealing with negative emotions. They haven't had multiple clients dealing with negativity. So they just focus on let it go. But the reality of it is, guys, you're letting go the lesson also, because the lesson is in the negativity. The lesson is, why am I feeling negative? This is what a lot of times fuels this idea of the imposter syndrome, is people feel that because they have these negative, depressed, insecure thoughts, that if people knew about them, if people knew how depressed I was, they would think I'm such a phony. Bullshit, excuse me, sorry. But no, you are afraid that your negativity is truly who you are. That's called imposter syndrome, because people think that the positivity, the smile on the other face, is a phony part because you're not dealing with the negativity. So I love positive thinking. I love it. But I also love negative thinking. I love neutral thinking. I love them all. It's not just about positive thinking. Okay, Amy? So I hope that helped. Great. Toby's saying perfect, zone in and focus on the negative, especially in a therapeutic environment. Excellent. Toby's a great addition to this page. He's always got great questions. So I hope that helped, Amy. Feel free, if you're still on, to send me some follow-ups or whatever, so that we can, I get some feedback from you. And by the way, I'm starting to get some trolls, and I'm starting to get some people who are just posting stupid crap. Again, I'm just going to delete it, but if anybody has an issue with how I do what I do and wants to come on and debate with me about where they're at and how they feel that their, brand of self-help is this or that, feel free. Okay. If anyone's watching this and they feel I'm full of, and you want to come on and debate with me about how people heal and all that, feel free. I'm not saying people who can be empathetically connected with you are bad. I'm not saying that. But when you cross over into telling people how to deal with their thoughts and emotions and you have zero training, and then you got people who maybe had some sort of post-traumatic stress disorder and they get healed through working with this, and then they write a book or put something out there, forgetting the fact that the work helped them heal, and not encouraging that and not identifying how that is. And then they're sort of making it seem like they are the healer. They are now the ones giving you advice. Just, if you're watching this, please question who you're getting mental health advice from, please. Because yes, I do feel that you need training in this field to adequately work on people's negativity. Thanks, Amy. I appreciate your opinion and experience, and I appreciate your asking the question. Thank you for that. So I think we'll probably close out unless somebody comes in on with something that we can work on. I do go through, hold on one sec. I do go through negative thoughts, but I try to use the positive out of them. Great. Nothing wrong with that. As long as you don't frame those negative thoughts as bad. As long as you don't frame those negative thoughts as something that you got to get away from, as something that shows, oh, I'm not as healed as I thought. No, people, every single human being has negative thoughts. Now, some people who haven't been through a lot of trauma, maybe they don't have as intensely negative thoughts as other people. People who have been through trauma are going to have more intense negative thoughts, and they're going to struggle with the idea that there's something profoundly wrong with them. Nothing's wrong with you, okay? So Tina, thank you, Tina. I have a friend who has been in a relationship for 11 years, unmarried. They have 2 children together. Their finances aren't that great, so she is in the process of starting a rewarding doctorate career, even if that means moving to another state. Her boyfriend loves his current job. In most cases, it takes 2 incomes for financial stability. What is your take on their situation? Should he follow her? He has not said that he would not be willing to move. However, it would be his choice. Yeah, that's a good one, Tina. Absolutely. That's more on the life coaching. I can slip into that. What I would recommend for your friend and her boyfriend is they really got to talk things out. They got to lay it out. You know, the last sentence, however, it would be his choice. That sounds like one of those situations where either you are telling her or she is saying, I don't want him to move for me. I don't want him to move for me, because I don't see why people say that. I don't know why people say that. When you're in a relationship, there's nothing wrong with selflessness. There's nothing wrong. What greater form of love can you show to somebody, can say to somebody is, I love you. I don't want to lose you. You're moving for a doctoral program. If you want me to come, say that. I will then make a decision based on knowing what you want. Maybe he wants to go, but he doesn't know if she wants him to go. This is the thing. I was talking to a client patient today about neediness. We have this idea, and remember, guys, when I say this, I'm not just, oh, I've got these ideas on neediness. I'm talking about seeing how this is played out in thousands of relationships that I've worked with people on. People are afraid of being needy. People are afraid of letting another person in your life feel that you need them. My take on that is this: a degree of neediness is a good thing. Okay? Now, I'm not talking about, think about neediness like salt or pepper, or salt or sugar in a stew. If you get that right, if you get the right amount of salt or sugar in the stew, yummy. Too much of it, same thing with neediness. I always encourage people to accept that there's nothing wrong with needing love. You know, I mean, it sounds so basic, right? There's nothing wrong. We need water. We need food. We need oxygen. We don't go around saying, oh God, I'm such a goddamn needy person. I need oxygen. Oh, what's the matter with me? Oh, I need food. Oh, I need that goddamn water. Why are we so ashamed to say we need love? Why is that so bad? So Tina, what I would encourage you to say to your friend, or if she's watching this or whatever, or send this to her, is if you want your boyfriend to come with you, to your doctoral program, friggin' tell him, let him know. But yes, of course, it's his decision, but at least he will know that that's what he wants to do. I'm in a personal current situation like that. Somebody in my life is working on something, and we had to make plans to. What's wrong with that? I'm a devoted, loyal husband. What is there something wrong with that? There's nothing wrong with that. Anyway, sorry about ranting, but yes, letting people in your life know that you need them to a certain degree. Nothing wrong with it in my book. Now, oh God, I'm going to kill myself if you're not around, and oh my God, that's a different story. We're not talking about that level of neediness. I'm talking about the idea that maybe in this current situation, they're not talking about what they need. They don't know. Maybe the boyfriend feels like, she could take me or leave me. So why would I quit a career I really like, a current job that I really like? If he doesn't know, maybe he needs to know. Okay? So let me just scroll down and see if Tina followed up with anything here. No. So I don't know if Tina, you're still on, but thank you for your question. Hope that helped. Do not mind switching into that whole life coaching thing. Prefer more of that deeper psychological stuff that affects all of us. So let's see if there are any more questions here before I wrap up. Diego, what are your podcast times again? Live Monday, Wednesday, Friday, 9 p.m. Mountain. So that's 8 p.m. West Coast. That is 10 p.m. Central, sorry, and 11 p.m. East Coast. I know it's a little late on the East Coast. I'm trying to work that out. So please tell your friends. Thanks, Pete, wise man. Thank you. I'm sure you're wise too. Amy, like the narratives. Thanks. Amy, what about trust issues? How do you work on it? Excellent question. Let's end with that. So trust issues. Yeah, I said this in a broadcast before. This idea that you hear people say, you either trust someone or you don't. Sorry, nonsense. Okay, complete nonsense. There are degrees of trust in a relationship. Okay? If you set yourself into a black or white about trust, this idea that you either trust someone or you don't, that's ridiculous. Think about it. There are degrees of trust. I may trust my wife into the, high 90s at this point. We didn't start that way. We've been together 10 years. I didn't just immediately trust her completely. She didn't immediately trust me. You earn it. Maybe there's a transgression in a trust at some point. If you look at it as a black or white, then you're never going to work on it. Trust is not a black or white, people. It is not. It is not you either trust someone or you don't. That is ludicrous. That is just saying, well, I'm either a Republican or a Democrat. So no, you can be a little bit of both. So let me see here. How do you work on trust? I don't know what's going on. Trust yourself? Are you in a relationship where you don't trust somebody? Then you guys should be talking about it. Is the person consistently affecting you in a negative way where you feel that you can't trust them? Then that's an issue. That's an issue that needs to be dealt with. Okay. So one of the things I would encourage you to do, Amy, is you've got to look at, what does trust mean to me? What does trust mean to me? Have I set trust up as an all or nothing? Okay, that's one of the main things. Absolutely, trust can be worked on. Absolutely. The way you work on it is you identify it. You say, I've got this trust issue. I don't know what's up with like we talked about psychodynamically in your past, Amy. Maybe people let you down a lot. Fear of disappointment is a huge thing with people. I don't want to get my hopes up. I always say, and I got a whole structure on how to deal with disappointment. Why are you so afraid of being disappointed? Why were you so disappointed? Not why were you so disappointed, but how did disappointment get to be such an issue in your life where you can't deal with it now? So The first step of working on it is identifying I have these trust issues and going through a system where you can start talking out the behind the scenes stuff that's affecting you. Okay? So I hope that helped. Absolutely, they can be worked on. Do not ever believe this idea. People tell you, "Oh, people don't change. People don't change." Isn't it funny how the people who say people don't change, those are the MFers who never change. Those are the ones who are continuing to hurt you and continuing to do the things and blame you for being hurt. So, let's see here. Tina followed up. She has made him aware that she wants him to follow. He said it depends on the cost of living. Okay, these are the questions they need to work out. That's great. They need to talk it out. They need to figure out how much money needs to be made. Who's going to be the primary provider? Maybe he's afraid that he's going to take on the burden of the financial strain. So yes, great to hear that they are talking things out. I would recommend that you encourage your friend to identify what it is about him coming that she needs, or like, how does she feel about him if he doesn't come? Like maybe she feels that means he doesn't love her or whatever. They need to work on that. They need to get into more of a one-on-one where they can just, this is what it is. This is what it'll look like. Are you down for that? Maybe he's not that into the relationship. I don't know. Maybe she's sensing that now that she's thinking about leaving, he's kind of pulling back. Painful, but no better time than the present, especially if you're starting a doctoral program. Trust me, they are nothing to play around with. People don't have any idea what we go through in these doctoral programs, not only financially, but emotionally, to get through them, to get in a position and learn what we need to learn. So anyway, guys, thank you for all your questions. No reason to apologize, Amy. I appreciate your questions. I'm sorry with all the questions. I was in a domestic violence marriage, and love now scares me. That's what I was sensing from your questions, that there was some sort of trauma that was affecting you. So Amy, real quick, not real quick because I don't want to talk to you, real quick because I'm trying to keep these to not too long so people don't tune out. Sorry to hear you're in a domestic violence marriage. That is not good. I don't know what level of trauma it was. I don't know how bad the domestic violence was, but I feel you. I don't know if you have worked on any of that. I don't know if you have dealt with some of that pain, but this is what I will tell you, Amy. It's not your fault that he abused you or she abused you. I don't know if it's same sex. It's not your fault that this person was victimized you the way he or she did. You need to deal with that pain and realize that trauma, like a flu, has some symptoms. So if I have the flu, I got a fever, I can't eat, I'm losing weight, I'm sleeping a lot or whatever. I'm not saying to myself, oh God, or sometimes we do, but I'm identifying the flu as causing me to feel sick. I'm not making global ratings about my own value based on the flu. Violence and trauma will do that. You will tell yourself things, Amy, like, I'm never going to trust anybody again. I'm never going to, love scares me. And that sentence alone, you need to sit with in yourself. Why does love scare me? What am I afraid of? What my advice to you is, Amy, I don't know if you've worked on any of the trauma from that domestic violence, but you've got to work through some of that. Okay, sister, you got to deal with that from a position of, I've talked about it before. I've got a cut on my hand. I got a wound. I got to treat it. I got to work on it. I got to put things on it, or I got to bandage it. I got to help it heal by what I'm applying to it. It's the same thing with emotional wounds. The domestic violence from the marriage is an emotional wound that you got to start dealing with. Okay, you got to. I don't know if it's through talking it out with somebody, but there are a lot of online places you can get counseling. People like me, I once in a while take on new clients, but you've got to say to yourself, it's okay that this domestic violence is affecting me. It's okay, but I got to work on it. Okay, because if you don't make it okay, it's never going to be worked on, Amy. So thank you for your questions. Please share this if you know anybody struggling. Monday, Wednesday, Friday, 9 p.m. Mountain. Please tune back in, tell people about it. I'm really trying to show people that talking to someone like me, I'm just a bald-headed dude with a bunch of skills and experience to help you heal. That's it. Dr. Phil and what he does and these people you see on TV, that is not therapy, because a lot of times they are the stars. They are the ones who are the healing. I'm the healer. Whenever I work with a client, I make it perfectly clear. You are the healing agent, not me. So if you've got emotional struggles, if you've got pain, if you've got anything that's affecting your ability to achieve your potential, deal with it, work on it. I'll see you guys Wednesday night. Please tell people about it, and we'll keep the ball rolling, okay? So thank you. Please send me any questions you have, either through Facebook, Twitter, or YouTube, or you can find, this is my website here. You can check me out on my website, send me questions through there. Been doing this over 20 years now, doctoral, master's, undergrad. Love it. Really do believe in it, but we've got to talk about our mental health. We've got to talk about our mental health the way we talk about our physical health. We are headed towards more and more polarization. It scares the crap out of me, because it's just people getting more and more, yeah, that's right. Oh yeah, I'm 100% right. Oh no, I don't want any information coming in, because that's going to make me question myself. I don't want to question myself, because if I question myself, then I don't know who I am. We need to question ourselves. Okay, that's why I started before saying, you got to get into who you are. Why am I the way I am? Okay, thanks for tuning in, guys. I'll see you Wednesday night. Please tell people about it. And again, thank you for all your participation. Be well. Talk to you soon. Take it easy.